Well, glaucoma is a condition of the eye where the eye pressures increase, and over a period of time, this high pressure in the eye causes an effect on the optic nerve. Now, this optic nerve is carrying our vision from the eye to the brain, and so when it gets affected, the vision gets affected. But it is mainly the peripheral vision, that is, from the sides, the vision starts reducing and over a period of time comes in the center. In the initial stages, there are no symptoms, and that is why glaucoma is called the silent thief of sight. It is something like high blood pressure. If anybody has high blood pressure, we take tablets and medicines to bring it under control. The reason being that if the pressures increase, it can cause problems like heart attacks, paralysis, etc. So similarly, high pressure in the eye is going to cause a pressure effect on the nerve and can over a period of time even cause blindness. Well, the exact cause is not known, but there are certain risk factors. One of them being age. People above the age of 40 or 50 are more likely to get glaucoma. Another is a strong family history. Like, for example, if your parents or your uncles or aunts or your siblings, like brothers or sisters, have glaucoma, then there are more chances of you getting glaucoma. The symptoms, like I told you, in the initial phases, there are no symptoms. It is only over a period of time that the vision starts dropping. So, the main symptom is a painless reduction in vision slowly over a period of time. Very often, patients come to us after the age of 40 to get their spectacle numbers changed. Very often, what we call as presbyopia, that means the near vision starts getting affected after 40. So, patients come to us for spectacle numbers, and glaucoma is most often detected by chance. When we check not only spectacle numbers, but we check the pressures of the eye, and we also look at the retina at the back and the optic nerve. And like I had said earlier, it is the optic nerve which, when affected, causes the decrease in vision. So high pressures of the eye and the damaged optic nerve are the telltale signs of glaucoma. So when we see that the pressure is high and there are changes that we are seeing in the optic nerve, we do certain tests. Now, one of the tests which is very important to us is what is called as visual field analysis. Visual field analysis is a computerized test in which the patient, of course, is made to look at a bowl, and in that bowl there are lights that come up. So every time the patient sees the light, the patient has to press a trigger. So it is computerized, and by this test we know what exactly or how much the peripheral vision has got affected. And this is a very important test to tell us or to detect glaucoma in the early stages. There are some more tests that we do, like the OCT, or it's called the optical coherence tomography of the optic nerve. It kind of gives us an idea about the functionality and the structural effect on the optic nerve. So these are some of the tests that we do to detect glaucoma in the early stages. Glaucoma, well, it depends on the stage at which you detect glaucoma. In the early stages, only eye drops are what are required. Nowadays, we have newer medicines or drops which not only reduce the pressure but they also protect the optic nerve. So they are called neuroprotective drugs. So basically, in glaucoma, because it is the pressure that increases, we need to bring the pressures down. There are 3-4 types of drops that are available which act in different manners. So we decide depending on the stage of glaucoma as to what are the drops that are required. And to decide on this, the tests are very, very important. They give us a clue as to which are the drops that are going to and the number of drops that are going to help this particular patient. In the later stages, or if we find that in spite of all the medication, if the pressures are not coming under control, then we need to do a surgery. It is called a glaucoma surgery or a trabeculectomy, wherein with the help of surgery, we bring the pressures down. The significance is that glaucoma is something that very many people don't know about. Most often, people come to us for decrease in vision. Most often, they think it is the spectacle number. Like they tell us that chashma number change agirbodu, adak bandi devu. So, the spectacle numbers is what they come for. And when we check everything, not only spectacle numbers, we check the pressures, we check the optic nerve, the retina. That is when we come to know that this person has glaucoma. So World Glaucoma Week is observed in the second week of March every year to bring about awareness so that people know that this kind of a problem can exist and it needs to be treated quickly. It needs to be diagnosed quickly and it needs to be treated quickly before the complete vision is lost. Thank you so much.